need to go to surgery and face involved?
Sure. My name is Andrew Sidlecki, and I helped found the Eye Institute of Buffalo. Since I've been in practice, probably performed up to 18,000 cataract surgeries. It's been really enjoyable to watch cataract surgery grow since I first started to where it is now, with newer equipment, newer techniques, better manufacturing standards. I tell my staff from time to time that we're in the happiness business. That's what we do. We deliver happiness to people by giving them their eyesight back.
How are you doing there, Barbara?
Fine.
Good. Doc's here.
When I counsel patients who need cataract surgery, I can sometimes read that they don't want the full explanation because they trust me and they just want to see better. So I'll tell them in brief that basically what we're doing is a lens replacement job. We're taking out the dirty, cloudy lens and we're putting in a clean, clear lens. And I tell them it's like if their glasses were smudged with greasy fingerprints, I'm the guy who's taking their glasses, cleaning them up, putting a new lens, and giving them their glasses back. So for the people who want it short and sweet, I tell them that it's a lens replacement surgery.
Chin rest straight ahead. Thank you.
Cataracts are progressive in every case. Often, the decision point that you have as the surgeon counseling the patient is when to take them out. I tell patients it is inevitable. Once a cataract begins to affect the eyesight, then surgery, the decision to do surgery, is an inevitable decision that they have to place somewhere in the timeline of their life, either sooner or later.
I noticed when I was driving at night, I was having a lot of difficulty with the blurriness, the headlights coming at me. I do a lot of needlework, I do a lot of reading. I probably read 2 or 3 books a week, and I wasn't able to see the print. I had to go to, some of them I had to go to large print books in order to be able to read them. But basically I was having a lot of difficulty doing the things that I like to do. When I'm cooking, sometimes I have a difficult time reading either a recipe or if you're following something on the box. I can't really, I'm looking, is that a third of a cup? Is that a half a cup? Is that, you know, I can't make that out real good. I have to really strain to try to see that. I play cards with my grandchildren a lot, and I also help them with their reading when I do their homework with them twice a week. Now, how about you reading this pair? Because maybe you can't see that. I was having a lot of trouble reading some of their words, you know, and it's hard when you're trying to teach a kid that these are the words and this is how you read it, and then you can't read the word yourself.
Back in 1953, when I was a forward observer in the artillery in Korea, I was using Boston long binoculars, and they were extremely effective in accomplishing the end that we had to use them for. Well, basically, I've had good eyesight. Of course, corrective lenses as I got older, which is normal with the territory. But I have noticed of late, I'm an incessant reader. And I want to tell you that reading the newspaper is a problem. I have recently picked up a fine volume, and with this type of quality paper, the reflection of good light makes it very difficult to read. In addition, nighttime driving is a real problem.
He's a good driver, but just can't see that well.
Well, I'm an artist and I love sewing. I paint and I make soft sculpture dolls and I do quilting. Lately it is the quilting that I love doing, and threading that needle is a little hard. I can't see the hole to get the thread in, and it's all trial and error. I paint on canvas and I can't see it well enough to go ahead and do it. Everything is blurry to me. I'm seeing like double, and it's like a shadow, what I see. I can't see the television, and I love TV.
Mrs. Molnar has a combined nuclear and central posterior subcapsular cataract, primarily in one eye, affecting her vision in general, particularly affecting her driving and night driving with glare and halos. We're going to take this cataract out, put in an aspheric Bausch & Lomb lens, and she should be as good as new. We're going to do a 360 degrees continuous circular tear capsulotomy. We use the Millennium phacoemulsification machine. We've had it for probably going on 8 to 10 years. It's known in the industry as a bit of a workhorse machine. That's been our experience. I'm making a central groove in the nucleus to about 80% depth. All right, half out. We'll mobilize the remaining half of the nucleus, emulsify that in the posterior chamber. So we'll go to automated irrigation and aspiration here. Such good control with the Millennium unit that you can really remove these little capsular remnants and cortical remnants easily without worrying about the posterior capsule. We have a nice stable anterior chamber, no trampolining of the posterior capsule. While I'm doing this, the technician will be loading the Li61AO lens, which is an aspheric implant made by Bausch & Lomb. I inject slowly. That's my natural technique. I know other doctors are a little quicker. Okay, so you can see the implant is perfectly centered inside the eye. Both haptics are in the capsular bag, creating a stable, centered optic. Patient surgery is completed. Perfect job. We used OcuCoat as our viscoelastic, which is what I use in my routine cases. We use the Bausch & Lomb Li61AO aspheric lens and the EZ28 shooter. Great technology. We've had good experience with that. So today was a tour de force for Bausch & Lomb in many ways. Except for the rarest circumstances, cataract surgery nowadays, I quote people 99% success rate. It's probably higher. We can't give them that type of expectation unless we're getting quality products from the manufacturing end. The manufacturing people have to understand that what they do is important, essential, appreciated. They are an essential link in the quality chain, and I would want to convey that to them personally. If I were speaking to the manufacturing force, I would want them to know that the surgeons in the field appreciate what they do and don't take their job for granted. It is a key link in the chain of quality from their point to the point where that piece of plastic goes into the person's eye. We can't deliver the quality we want without them doing their job. The equipment we use, the implant that we use, is my signature for the patient. It's what I leave behind. It's the only evidence that I've been there. Everything that comes through that manufacturing process, they have to think that maybe that particular implant would be the one that's going to go into their mom's eye. You don't know. You don't know where that implant's going, but everyone has a mother. And that implant is going into someone's mother's eye. And they have to look at the process in that way, that it has to be the highest quality every time, over and over again. And you can't lose sight of the fact of how important it is that they do that job and they do it with pride. And we do appreciate that. Those of us who utilize the lenses appreciate what they're doing and thank them. Good morning, Barbara.
Good morning,
Nice to
Dr.
see you.
Swifty. It's good to see you.
You had a good night, I presume?
Yes.
Excellent.
I like your tie.
Yeah, thank you. It's my son's tie, actually.
That's why it's all wrinkly.
It goes nice with your shirt.
Thank you, Barb. Yeah, well, you can see it better now because
Yes.
of your eye
Well, the
surgery.
colors are so much better.
It's noticeable. Yes.
Yes, the colors. That was the first thing I noticed last night when I was watching TV and reading the menu, the color of it. And I went, whoa, I was really surprised.
Good morning.
Nice to see you. How was your evening?
Nice to see you too.
Literally, huh?
Literally.
It's great.
It's very good.
Well, did Jerry tell you your measurements were 20/20 this morning?
No, wonderful.
20/20, no glasses in the distance.
Oh, that's terrific.
Okay, you have what's called an aspheric implant. It's an implant that corrects vision to even a clearer level than most of the implants that are available on the market today. So you're fortunate that technology has improved to a point where you can receive this type of high technology implant.
Wonderful.
And did you have any problems overnight?
Nope, not at all.
No difficulties.
None at all.
Comfortable?
Very comfortable.
Great.
When I had my eye tested this morning after I got here, they said it was 20/20, which is fantastic. I have noticed a great difference in my eyesight. Like I said to the guys before, I can see clearly now. And there's no blurriness, there's nothing. It's wonderful.
All your measurements are excellent. Let's see what you got here.
If you see anything with feet in there, let me know.
Yeah, I will. I'll give you the heads up. Okay. Just look in the straight ahead direction and blink your eye a couple
Straight
times.
at you, right?
Straight? Yes, sir. Well, that's as good as any patient I've seen this morning. You're a good healer. Probably that positive attitude of yours, Jim.
Oh,
No
wonderful.
one can keep you
wonderful.
down no matter what here.
Oh, I want to tell you, what a difference.
Just look past my right ear, please.
Okay, look past your right ear. Indeed I am.
That works fine. Internally great, implant perfect. That's as good as an eye can look on the first day.
This is absolutely incredible. To realize the difference in perception and color, that I just cannot believe it. And it's nice to be able to read some of the road signs now.
Yeah,
And
I was amazed.
honestly, I was looking at a piece of paper a few minutes ago. If I covered this eye, that it was a shade of tan, and I uncovered this eye, it was perfectly white, just beautiful. It's a marvelous difference. I'm certainly looking forward to having the second eye done because it's so marvelous to have that right eye so changed that I want to have that kind of vision in the left eye as well. It's amazing in terms of driving, reading signs, awareness of road. Believe me, it's a tremendous difference. And I think my wife will agree on that.
Yeah, coming over today, of course, I was driving, and he's reading the signs. He could not read them before. Just with one eye fixed, you know, so we're looking forward to having that other one done. What a difference it's going to be, because I've been so nervous, you know. He wouldn't let me drive, and I knew that he shouldn't be driving, but he did okay, but it'll be it'll be a big difference now that he can see.
Now, there's no question that these people have to be very proud of the work they do based upon the results that people like me are getting from them. Thank you.
It just almost brings you to tears. The difference that he is made already. And then we're going to have the other eye done. But it's a big change.
If I could see the people that are involved in making this, I would tell them what a wonderful thing they're doing, because it's hard when you can't see and you can't do things, and now it's so clear that I wouldn't be able to thank them enough for what they're doing.
Thank you. Thank you very much. It's great to be able to see a lot better than what I was. I didn't realize how bad it was before until now. And I'm very, very thankful for this.
I would like to thank all of the people that had to do with the manufacturing of the lenses that are in my eyes that are going to give me the opportunity to enjoy life much more fully than I have been and didn't realize how badly off I was.